Does the ketogenic diet really help you lose weight? Our health advice: lose weight by eating fat and excluding sugar. This is the surprising promise of the ketogenic diet. How does it work? Is it effective? We take STOC. Lose weight by eating fat. This is the surprising promise of the ketogenic diet. Used for almost a century against certain forms of epilepsy, the ketogenic diet has gradually made its way alongside weight loss diet. For some time now, it has enjoyed some success, as evidenced by the 20 or so books published in recent years and the numerous press articles which are frequently devoted to it. How does this diet work? What do we know about its effectiveness? Figaro takes STOC. What is the ketogenic diet? The National Food Safety Agency, ANSES, considers that, for an adult, approximately 10 to 20% of the energy must come from proteins, 35 to 35% from lipids, fats, and 40 to 55% of carbohydrates, sugars. The ketogenic diet is based on a drastic reduction in carbohydrate intake, no more than 50 grams per day for an adult, in favor of a massive lipid intake, 70 to 90% of total energy intake, with a protein intake that remains at 15 to 20% of intake. Rather counterintuitive, in a world where fat plays the wrong role in the collective imaginatio. Cereal-based foods, bread, pasta, rice, potatoes, prepared meals, sweets, cakes and milk, rich in lactose, which is a carbohydrate, should be avoided. Certain fruits and vegetables, too rich in carbohydrates. A banana provides about 30 grams of carbohydrates out of the 50 required, are also to be avoided, as well as legume. On the other hand, it is necessary to bet on all foods rich in fat and protein such as vegetable oils, butter, eggs, meat, fatty fish, avocado, coconut or oilseeds, almonds, hazelnut. In practice, it's a very difficult diet to follow, says Professor Luke Seinober, head of the biochemistry department at Cochin Hospital, a PhD, and author of All About Your Weight, Don't Take Risks. Michelle Laffin. How it works. To function, the body has three types of food fuels: carbohydrates, fats and protein. When carbohydrates are very low, as is the case with the ketogenic diet, the liver begins to manufacture ketone bodies from dietary fat or fat stores in the body. The body is said to be in ketosis. It turns into a fat, burning, machin. Ketone bodies therefore become the main source of energy for most of our cell. This change occurs on average between 2 and 4 days after the adoption of the regime. Does the ketogenic diet help you lose weight? A drastic diet of this type is certainly weight loss, says Professor Seinober. The individual can lose several pounds in a month. But the problem with these extreme diets is that there is a rebound effect. Often people regain more weight than they initially lost. The famous yo-yo effect, which is found in all diet. Studies have shown that low-sugar diets make it possible to lose weight more quickly than low-fat diets. But in the long term, the weight curves converge, says D. François Journavaz, head of the Diabetologie Uni, at the University Hospitals of Geneva and author of several scientific articles on the ketogenic diet. According to the doctor, this diet, where carbohydrates are virtually eliminated, must be distinguished from low-sugar diet. We have reason to think that moderately low carbohydrate diets, which do not exceed 130 grams of sugar per day, could be beneficial, especially for diabetic patients, he say. But you have to be extremely careful about the type of fats consumed and favor those of vegetable rather than animal origin. Otherwise there is a risk of developing fatty liver, hepatic steatosis, and hypercholesterolemia, with harmful effects in the long term. For the moment, even if the promises of the ketogenic diet extend weight loss, but also cancer, Alzheimer's disease, etc., it should be remembered that its effectiveness has only been scientifically proven in epilepsy. Are there any side effects? In the short term, switching from a conventional diet to a ketogenic diet can lead to nausea, constipation, fatigue, headaches, cramps, bad breath. So many inconveniences mainly related to dehydration. With this diet, the body is forced to use its glucose reserves, explains Professor Luke Sinobe. But in the muscle, glucose is stored with weight. Its use therefore leads to the elimination of water, which contributes to weight loss but also to dehydration. This diet, which involves a decrease in the consumption of fruits and vegetables, can also lead to deficiency. There may be a deficit of vitamins, minerals and fiber, abounds Professor Sinobe. Hence the need to take advice from a dietitian or nutritionist before embarking on such an undertaking. In the long term, the consequences are poorly understood. Most of the scientific work done so far involves a small number of participants and/or does not include a control group for comparison. The strongest data we have comes from children with epilepsy, says D. Jorneva. They show that there is, in the long term, a risk of developing kidney stones, osteoporosis and a growth disorder. In a report on weight loss diets published in 2010, the National Food Safety Agency, ANSES, recalled that the search for weight loss without formal medical indication entails risks, in particular when recourse is had to practices unbalanced and poorly diversified diets. In addition, the agency stressed that nothing can replace, in terms of health, a balanced, diversified diet, ensuring that daily energy intake does not exceed requirements. Man is programmed for balanced and omnivorous diets, recalls Professor Sinobe. Needless to say that stuffing the body with lipids by totally evicting carbohydrates is probably not good for your health.